Birth control for teens, always a touchy subject. Now a group of doctors wants to prescribe the morning after pill for teens before they need it. Channel 11's Darieth Chisholm has been talking to our doctors about this new push. Darieth?
The American Academy of Pediatrics is recommending the morning after pill be prescribed in advance to teens just in case one day they need it. This is part of an initiative to educate doctors about available emergency contraceptives and encourage routine counseling and advance prescriptions of emergency contraceptives as a public health strategy to reduce unwanted pregnancies. They say emergency contraceptives like Plan B and Next Choice can curb a U.S. teen pregnancy rate, which, while declining over the past 2 decades, still surpasses that of other developed countries. Though this may create an ethical dilemma for some physicians and pharmacists and a pushback from some other groups and parents, the Academy said pediatricians have a duty to protect their patients.
The American Academy of Pediatrics is taking this position to remind pediatricians that this is an issue which is really a pediatric issue. The pregnancy rate that I cited before is for 15 to 19-year-olds. This is a pediatric issue, and so it is really the duty of pediatricians to help keep their young female patients safe and healthy.
Morning after pill is most effective if used in the first 24 hours, but can be taken up to 120 hours after unprotected intercourse. In all U.S. states, females 17 and older and males 18 and older can get contraceptives without a prescription from a doctor or pharmacist, while those under 17 still need a script. Reporting live, I'm Darieth Chisholm, Channel 11 News.
The recommendations of the American Academy of Pediatrics that adolescents should be prescribed emergency contraceptive pills in advance.
Yes.
I think that that is consistent with what other organizations have previously recommended and is an important step towards promoting adolescent health in our country.
Do you think it's long overdue, or?
I think it's a good step. And I think other people have agreed with that step for a long time.
What do you see as the benefits of this?
I think anything that we can add to our armamentarium to help prevent unintended pregnancy among adolescents is an important step to take. And we have an important problem in our country of unintended adolescent pregnancies. The birth rate in our country is about 34 per thousand, which is substantially higher than any of the other Western democracies that we're comparable to. And that is not because we have more adolescent sexual activity in our country. It's really due to problems with contraceptive access, consistent use, and in some cases non-use. So anything that we can do to provide an adolescent with a second chance to prevent an unwanted or unintended pregnancy is important.
What do you think, what should some of the guidelines be? Some people say it's against like the parental rights to, do you think parents should be notified before any of this can take place, or?
I think as pediatricians, we always strive very hard to help our patients involve their parents in their medical decisions. With that being said, there is some care that's really so important that adolescents get in a timely way, that there are some types of health care that we allow adolescents to obtain based on their own consent in order to protect their health, and this is one of those.
Why hasn't this happened before? I mean, why? What was the sticking point? I mean, why hasn't someone recommended this before?
I'm not sure that this is probably the kind of tack that you want to take. This was a recommendation that was made in a position paper by the Society of Adolescent Health and Medicine that I was part of writing more than 5 years ago, that we provide adolescents with emergency contraceptive pill prescriptions in advance of use.
So this was one of your?
I would not sort of claim sole credit for that. It's been advocated by lots and lots of people other than me and long before I did, but the position paper from the Society of Adolescent Health and Medicine, which was led by Dr. Melanie Gold, also from this institution, which I helped her in writing. That position paper also recommended that adolescents receive information about emergency contraception and prescriptions in advance of need.
So this isn't something new, this is just,
So to put it a little bit in context,
Yeah.
emergency contraceptive pills have been available in our country for many, many years. And there has been a dedicated product specifically for this use, also available for many years. The things that have changed more recently are that in 2007, this product became available over the counter without a physician prescription for most women, and then in 2009 it became available for girls 17 and older, which is the current state of affairs, without a prescription. It is of course available to girls under the age of 17 by prescription still. And so the context is that this is a safe, incredibly effective medication that provides women with a second chance to prevent an unintended pregnancy, which really should be incredibly broadly available for those women, including young women who need it because they've been exposed to an unintended pregnancy. And the American Academy of Pediatrics is taking this position to remind pediatricians that this is an issue which is really a pediatric issue. The pregnancy rate that I cited before is for 15 to 19-year-olds. This is a pediatric issue, and so it is really the duty of pediatricians to help keep their young female patients safe and healthy.
so this should be prescribed, available along with information, right?
Absolutely. This is one tool in the toolbox. As pediatricians, we also speak to our adolescent patients about abstinence. We talk with them about talking with their parents and their families about their sexual decision-making and values. For those patients of ours who choose not to be abstinent, then it's really our job to keep them as safe and healthy as possible. And so there are a number of different options for young women to use to prevent pregnancy. The most commonly used methods by adolescents, unfortunately, are those which are least effective, so condoms and withdrawal. The next most commonly used method is birth control pills. None of those methods are anywhere near as effective as the long-acting reversible contraceptive methods, such as the implant and the IUD, both of which are safe and effective, significantly more effective than birth control pills for adolescents. But for those young women who have been exposed to an unprotected sexual intercourse, Plan B, emergency contraceptives, which is what this recent policy statement were about, are another method that adolescents can use to prevent themselves from getting pregnant. And I think that this is something as pediatricians we really owe it to our patients to discuss with them.
So the bottom line is the more tools you have, the better you can curb the unintended pregnancy rate.
Yeah, as much as people don't like to think about it, unfortunately, about 10% of the time, adolescents, women's early sexual experiences are not always consensual. And so it is really important in terms of thinking about how to protect a young woman who's experienced something like non-consensual sex, to really take good care of her health, and this is one aspect that really must not be forgotten.
Anything else?
Only one thing, which is that I do think in terms of the significant problem in our country with unintended pregnancy among young women, that we should really be advocating for our patients who choose not to be abstinent to use the most effective methods, and those are really the long-acting reversible contraceptive methods such as the IUD.